Hi, I'm Nicole. I'm an assistant at Pet Care Veterinary Hospital, and I'm going to show you today how to syringe feed your rabbit with a supplement called Oxbow Critical Care. I will also show you how to mix that supplement together. Then I'm going to show you also how to medicate your rabbit. This is the Critical Care. I'm just going to pour a small bit into the container. You just want to mix it to desired consistency. And then I have just a syringe full of water here that I'm going to squirt in there. What I like to do is I like to have the water drawn up for the amount of food that I'm going to feed. So if I'm going to feed my rabbit 10 cc's of food, I'm going to have 10 cc's of water drawn up. Oxbow Critical Care is used in rabbits who are not eating on their own. You want it to be about the consistency of a runny oatmeal so that it'll pull through the syringe. The grain in here is kind of thick and can be hard to draw up in the syringe. What you're going to do is you're going to just sort of coddle your rabbit. You have him close to you and have one arm on the other side of him, and then use this hand to sort of pick his chin up. And then on the side of their mouth they have this little opening in between their incisors and their molars. And you just want to slowly squirt it into their mouth. Sometimes they may spit it out, so it's always good to have a rag handy so that you can clean it up. But just a little bit at a time is all that you need to do. It's generally the same thing with their medication, with medicating them. The medicine, you just pull it up. In this case, I'm giving him 0.25 cc's twice daily, and so I'm going to go ahead and pull that up through the syringe. Normally with the medicine it needs to be refrigerated and shaken. And I'm going to do the same thing I did when I syringe fed him. I'm just going to hold him close to me and put my other arm on the other side of him and using my other hand to hold his chin up, and then just go in here through the side where they don't have any teeth. And they generally just automatically start licking out of instinct, and you just slowly give him the medication. Sometimes a rabbit can be difficult with restraint, and you may need to wrap them in what's called a rabbit burrito. And in order to do that, you just leave him flat on the surface, and you put part of the towel in front of his feet so that he can't kick it out, and you wrap him snugly in the towel. That way you have him restrained well, and you don't have to worry about him kicking and jumping around when you're trying to syringe feed him or medicate him. This makes it easy for you to be able to do it by yourself and not get anybody else to help you. So you want to syringe feed your rabbit until he's eating on his own, or until recommended by your veterinarian. Same thing with his medication. Always go according to the label directions or your veterinary's instruction. And in no time, your rabbit should be good as new.